So we're very happy to have you all here online and partaking in this event, because I think it's really important to have this chat, have this conversation, and be informed and get as much information as we can out of tonight. I think it'll benefit everybody. My name is Claire Brock and I'll be chairing tonight's discussion, and I'm joined here by our expert panel, people both living with the condition and doctors, experts in their own field of treating people with HS. So I want to thank those of you who pre-submitted questions. We have a load to get through and we're really happy to bring those questions to the panel, and they'll enlighten us with their views and their insight, which I think will be helpful to everybody. For those of you who are watching and tuning in at home and online, you can submit questions during the course of this conversation, and I'll put those questions to the panel later on. And we're also going to have an online poll, which we will conduct a little while into the panel chat here. We'll be putting a question out online and we'll bring you the results of that survey later on. So without further ado, I'm going to introduce the panel who's here beside me. So first off, to my far right is Suzanne Maloney, who lives with HS, and she'll be talking through her experience and her drive to help other people who are going through a similar thing. So she has a great story and a great story to bring to us today, and to help people along on their own journey with HS. To my right is Dr. Anne-Marie Tobin, a skin specialist who has a particular interest in this area of dermatology. She works in Tala Hospital and she's also a clinical senior lecturer in TCD. So we're very happy to have Anne-Marie along with us tonight. To my left is Barry McGrath, who has set up a great Facebook group and is bringing his own journey and bringing other people along on that, and helping support people through a great, I suppose, peer-to-peer network, and it's been really helpful. So look forward to talking to Barry about how he manages his condition. And to my far left, we have Dr. Catherine Wilkinson, who's a GP. So she's someone who's at the coalface of helping people, and maybe a first point for many HS sufferers who will come to Catherine, and she will help guide them through the best way to manage the condition and send them on for further help and assist them in the community. So that's all really important. So without further ado, we'll get started on our discussion. So I guess firstly, look, it has a big long name. I'm going to call it HS. Anne-Marie, you might want to go through the whole, clinical side of things, but we want to get an overview about what is HS, how common is it here, how many people in Ireland are living with this condition, and perhaps you can start us off on that.
So HS is a clinical definition. So there's no, there's no tests, or there's nothing bar a history that gives you the diagnosis. And what it was set down in a statement by the HS Foundation about 4 or 5 years ago. It's if you are getting recurrent painful boils under your arms or in your groin over a 6-month period. So anyone can really diagnose themselves with HS. So from that point of view, that's the clinical diagnosis. With regard to the numbers of patients in Ireland, we've done a study looking at the epidemiology, or that means how HS presents in Ireland, and about 2% of the population have HS. So that's an Irish study of actual Irish incidence of HS. So 2% is a lot. That's actually 2 out of every 100 patients.
Okay. So there's probably more people with HS than people who have HS realise, in fact.
Yes, absolutely. And I think because it's perhaps a disease that people won't talk about or not necessarily proffer the information. It's unlike psoriasis or acne or eczema, which you can see, you can tell, if someone has it, that people with HS may think they're the only ones with it, but in actual fact they're not. They're part of a pretty big patient cohort. But having said that, within that group of 2%, not everyone is going to have the same degree. Some will have mild, some will have moderate, some will have more severe, and that's important to remember as well.
Okay, when it comes to causes of HS, do we have an idea of why someone may develop it?
So the three things that there's a number. It's like a lot of conditions. It's not just one thing causes it. So there definitely is a genetic predisposition. So 1 out of 3 patients will have a family member with a diagnosis of HS or something called a pilonidal sinus. It's where you get a very inflamed, ingrown hair follicle at the base of the back, or severe acne. So there's definitely some genetic component, not in all patients. And then there are environmental factors which drive it. So that's smoking. So a large number, we know that a large number of patients with HS smoke, and for some, we're not actually sure how it works, but we think that smoking changes the immune system on your skin. And then friction drives it. If you think of where you get HS, you're getting it at sites of friction. So that's the other driver. And then there's definitely a hormonal influence in that more women tend to get it than men, but that hasn't been fully teased out. The exact hormone profile hasn't been fully teased out. So there's a female preponderance, and then it can be more common if you're overweight. Again, if you think it's frictional, that's going to make sense. So that, the genetics, the environmental factors, if you like, all feed in to give you this, what we would call an auto-inflammatory condition. We are getting an awful lot of inflammation around hair follicles, and that's driving the disease.
Okay. That inflammation that Anne-Marie is talking about, is that what first made you realise I have something here that is, you know, a little bit more than just a spot or something like that for you, Suzanne? When did you first notice that there was something really wrong?
I would have been around 13, and no, I didn't. It wasn't inflammation. It did start out as kind of small abscesses, I suppose, down around my groin, and I just try to treat them with home remedies. And
that's a really difficult age to find out, isn't it?
Yeah. And I suppose you're mortified as well. So I didn't really say it to anyone until it was too bad to ignore. So I was 17, and then my mum just took me to a GP.
You went through several years where you'd maybe looked it up on the internet, worked it out yourself. Had you got a name for it before you even talked to your mum about it?
22, I think, 22 or 23 when I was diagnosed. So it took. I'm a classic case, I think, when you look at the studies that have been done. So I was passed from doctor to doctor. They thought I had Crohn's disease, and that was ruled out. And then actually a surgeon diagnosed me after lots of other investigations. So it took a while.
It's very difficult, and I imagine no matter what age you are, it's difficult. But when you're going through those teenage years, and that in many cases is when it first presents itself.
I think so. Yeah, I think it happens a lot. Yeah, it was tough.
Yeah. And did you find, Barry, was that what age you were when?
I was roughly the same age as Suzanne when I first developed symptoms. I hid it for as long as possible. Took about a year before I sought any type of help with it, and went to my GP, who had never seen anything like it, and I was passed around from doctor to doctor, and it took about 20 years before I formally got a diagnosis.
20 years?
Yeah. I used to withdraw into myself, and I usually progressed to the stage where I needed surgery. And surgery helped from time to time. It sometimes gave me a few months relief, sometimes a few years, but it always came back. And that was the recurrent and incessant nature of it. I found very difficult to deal with.
Yeah. And Catherine, how important is early diagnosis?
I think it's very important, as Suzanne and Barry have highlighted to you here, for many reasons. Psychological reasons, just living in isolation with that condition, not opening up to other people about it for 4 to 20 years. It's going to have an impact on your mental health. Because we do know that hidradenitis is associated with higher rates of depression and anxiety, and some stats would even say up to 40%. So that's certainly one thing. I mean, it's obviously its impact on your quality of life while you're waiting for that diagnosis, absenteeism from work, you know, inability to exercise maybe in the way you would like to because of pain. As well, like what I've seen with patients in general, when they get their diagnosis, you know, even if it's not HS, even if it's a different diagnosis, there's a great sense of relief for that patient and validation for them, because now they're able to, okay, well, this is my diagnosis. Now I can empower myself with knowledge, and they can start on their road of getting more control over their condition, and I suppose getting that validation that no, this condition isn't their fault. It isn't down to lack of self-hygiene or something that they're doing wrong. So I think that's really important. And obviously, as Barry's highlighted, I mean, you know, the sooner you get the accurate diagnosis, the sooner you can start to be treated correctly.
And in terms of treating the condition and getting that diagnosis, does it lessen the severity of it the earlier it's diagnosed, Anne-Marie?
Well, there's no studies actually conclusively proving that, but in fact it makes sense, because in addition to sort of the social isolation, and also people will make adjustments to their lives to manage their HS. So they may not, you know, go for that job, or they may not go into that relationship because they've HS. The other thing is, if the disease progresses, you get scarring. So even from a physical point of view, so intuitively, the earlier you can get it, to try and intervene both with treatment and altering lifestyle, one would hope that you would be able to alter that.
Okay, because that's one of the questions that's come in. Are there different outcomes for patients if they get an early diagnosis as opposed to getting one much later on? So in Barry's case, it was 20 years. And I suppose that's a question when, if this was found out sooner in Barry's case, would outcomes potentially have been different for him?
We don't know for sure, because the data isn't there to support that. But as clinicians, we would like to be getting the patients much earlier.
And do you feel that way? You say, I note your frustration there a little earlier on, but for you, the diagnosis was really key to then how you could get help and how you could psychologically, I guess, feel you could get a grip on it and manage the condition.
For the first few years, it was very difficult to handle. I was told it was just one of those things. It didn't have a name. And that was very difficult. But as Catherine pointed out, once I got a name, I could go online and start searching and empower myself to find out more about the condition, what I could do, what lifestyle changes I could make that could have a positive impact. And yeah, it was a great sense of relief at the time.
And a turning point.
Absolutely, yeah.
Okay, let's talk about the day-to-day impact that the condition has on your life. You found out when you were just a teenager, 13 years of age, and we know everything we're going through at that age in our lives anyway. Yeah. And you kept it a secret. How did you cope with it? How did you get through the days, school, college,
actually
after that?
I think I just got on with it. It wasn't that bad when I was 13, and actually it definitely took a change when I was 17. It got a bit worse, but I would say when I was in my early 20s, it was the worst. That's when I started having surgeries. And so on a day-to-day basis, I think I don't know really. I just got on with it. And then when it was really bad, if I was in work or in college, I'd just take painkillers and try and distract myself, and then get home, and then I'd be like, oh God, what do I do now? But when I was out and about, I would just try my best to get on with it. But obviously there were days where I would just take the day off and stay at home if it was particularly bad.
But pain relief, mostly to help you plough on through and get on with your day.
Yeah.
Is that true for many patients, Anne-Marie?
Yeah, it's a very painful condition. And I mean, that's one of the things that's very different about this condition compared to other skin conditions. Like with psoriasis or eczema, it's itchy, but it's not painful. Whereas now, and I don't have HS, but typically, as the boil is coming up, it's exquisitely painful. And then when it bursts, there's almost a sense of relief and the pain goes out of it. So there's a cycle of pain. So we'd often, have to give painkillers for our patients. It's a huge thing.
Yeah.
And that can limit, work. If you can't, I have a patient with a physical job who's contractures under his arm. And, how limiting is that?
And have patients said to you that they find it difficult to broach that in work with their employer?
Well, no one's actually said it specifically, but you can imagine.
Yeah.
Yeah, absolutely.
Did you find that to be the case, Barry, that you had to find a way around it, you had to get on with your life, but things like physical exercise, things that we just take for granted, like going for a walk around the block, may have proved difficult?
They were extremely difficult. There were some very tough times. I remember when I had it in both armpits for over a period of about a year. And even basic tasks, dressing myself, having a shower, cooking, cleaning, things like that all became excruciatingly difficult at times. And yeah, it was very difficult to manage even the simple things. When I had it in my groin, I found even walking up the stairs at home was exceptionally difficult at times. And that is very difficult to take. It has a profound psychological impact on you when this happens day after day, week after week. Yeah, you get some respite from it from time to time, but it's the incessant nature of it. It keeps on coming back, and you're waiting for surgery to try and correct the problem. But it's tough.
And you're relying, I suppose, if you are sharing it with people, on support from friends. But it is good to talk about it. You probably found that when you did reach out, the support was there.
Yeah, I kept it to myself for a long time, and if I've one regret about all of this, it's not opening up to my friends and family at an earlier stage, because they've all rallied around me, and they've all been fantastic. The overriding emotion in the early years was embarrassment and shame, thinking that I'd done something wrong and that there was something inherently wrong with me. When all the time this great resource was there in terms of family and friends. And in more recent years, the Facebook group have proven to be an exceptionally good source of strength and support.
So you were surprised by the positive reaction that was and the support that was there when you said it to people?
Yeah, it's been overwhelmingly positive. I don't think I've had one negative reaction, whereas that was the fear all the time that I kept it to myself.
That's where the psychological aspect of this comes in, doesn't it, Catherine? When patients first go to you and they say, I don't know what this is, but it's ruining my life, what can you say to them? Is it very clear to find that, to be able to diagnose it? In your case, you can do that because you're a specialist in the area, but how helpful is that diagnosis then to people?
Well, I suppose, as Suzanne and Barry have highlighted, there are, they've had challenges in getting their diagnosis. So I suppose, we have to acknowledge that there is a need for more education amongst all clinicians, I think, in this area, to help make that diagnosis, to set the person on the right path. And certainly, just from a GP perspective, I think things are improving, certainly in that area. And only last week, I was actually received an email from a GP educational website that has got 3,000 registered members, inviting me onto that website to view an educational video given by a Dublin consultant dermatologist on hidradenitis. So 3,000 GPs would have received an email inviting them on to look at that video. So I do think things are improving in the area. To patients who are suffering from mental distress, please make an appointment with your GP to discuss that. Often people find it really hard to talk about their mental health. They're embarrassed to talk about it. Oftentimes I find that a patient will come to you with 4 different issues, and it's just as they're going out the door, they might start talking about how this is bothering them. Whereas I would say, and that limits then, I suppose we're limited then for time in how we can explore the issue on that day. So what I would say to people is just, don't wait for the ear infection or the throat infection to make your appointment to go to see the GP. Just make this today. I'm going to go to my GP and I'm going to talk to that person about my mental health. Talking about mental health is our bread and butter. they say that 10 to 20% of GP consultations relate to mental distress. So it's certainly, we can signpost you, even how to obtain local counselling, because counselling can be hard to obtain, it can be expensive, but oftentimes your local GP will know of local low-cost counselling services that you can go to. And I suppose as well, just, maybe explore, sometimes medication's needed, sometimes it's just an empathetic ear. And actually, oftentimes as well, people find it quite hard to explain how they're feeling. And what I'd say to those people is that what I find very helpful is the DLQI questionnaire. So it stands for Dermatology Quality of Life Index questionnaire, and it's actually mentioned on the Irish Skin Foundation hidradenitis leaflet. And you can tick, it explores how different skin conditions might affect you emotionally, and you tick whatever box applies to you. And even if your GP hasn't seen that leaflet before, I would say bring that leaflet in with you, and it will highlight to that doctor pretty quickly how this condition is impacting on you.
So there's a lot there, and the support is out there once you can, mention it when you come to your GP, talk to them about it. There's a load of good tips there, Catherine, so that's great. Just on this, and I think we've touched on it there, the questions that have come in on this to doctors, HS can have a huge impact on quality of life. Take us through some of the challenges. I think we've discussed some of the challenges there, the physical and the psychological challenges, and how do you ask for more help? And again, I think you've touched on that there, that, go and the supports are there. And you mentioned there the Irish Skin Foundation and the help and the supports that are out there, and the training that GPs are getting in knowing what HS is and how they can help sufferers. There's a question coming in to Barry and Suzanne. What is one thing you wish your family and friends understood about HS? That's a good question.
Well, with my friends, I think my family understand completely, so they are really supportive. With my friends, they're actually really supportive now, but maybe when I was younger and we were going out, if I cancelled a night, like bailed on a night out, that they would not be annoyed at me, because they'd have been like, oh, I can't believe you're not going to come out, or things like that. Or when I was having surgery, I never really told them, so it's not their fault that they didn't understand. So maybe I would say it's not something that I wish they understood. It was I wish I had told them sooner.
Okay. Communication there again, telling people, and then, for them to give you the support back. But is there anything there that you think, look, I wish they kind of got this sometimes, because it can be hard to articulate as well to our nearest and dearest, can't it?
It can, yeah. One thing that the other panelists have mentioned is the multifaceted layer that is HS. There's a hell of a lot more to it than just the physical. It's been an emotional roller coaster ride. Financially, it's been a disaster because of the cost of medications, bandages, and so on. And Suzanne is looking at that in some of her work at the moment. Professionally, it's impacted on my career, and I know that others. It's difficult to explain gaps in your CV that you had to take to undergo surgery and recover. It impacts you physically, as is obvious, but it also impacts in other ways, such as socially and sexually. And the latter is one thing that people don't talk about enough. Recent studies have shown that 2 out of every 3 people with HS have serious sexual health difficulties. And I think one thing that I wish friends and family understood more was that there's multiple layers to this, and that would be the key message.
And how much, as you say, it can affect personal relationships and prove to be a real challenge for someone. Yeah, it seems, as you say, something that, and everyone is relating to that here, I think, today, how it can affect you on so many different levels.
Yeah, on that note, I was speaking to a psychologist about it, and she was saying that you can compare a HS diagnosis with bereavement.
Right.
And grief, because you are essentially losing a piece of yourself to a disease. So it's Yeah, it's a really good way of putting it, to try and explain to people what you're going through.
With that in mind as well, that when there is a diagnosis, there's also hope that you can now begin to manage it and, you know, work with the experts. So there are points, and we touched on it a little bit there, about risk factors. What are the risk factors as you see it, Anne-Marie?
Well, as I said, a family history, and often the patients with most severe disease will often have a family history, so that's something you can't control. But there's various strands to treating HS. You know, there's medical, there's a role for surgery as well, and then there's lifestyle modification. So, you know, one of the things, giving up smoking, that's an important one. Watching your weight, that, you know, and healthy diet. But it's a very hard thing, because you're asking patients, so it's a very hard thing on a number of levels. One, you're asking patients to give up smoking, then you're asking them to lose weight. And like, often there are two very, you know, difficult things to do. And then there's you know, there's not good support for doing that. You know, it's very hard to get an appointment with a dietetic.
Arguably, you have enough on your plate.
Exactly. So yes, so you're asking patients to do all this as well. So it can be a very, very difficult ask. So I think often you have to get patients better.
And then focus on how to make things even easier for them and to help them through. Before I forget, there is an online poll that we're going to put up, that those of you at home, if you wish to take part, and you can, there's no obligation at all, and we'll bring you the results of that survey, and then we can have a quick chat about that a little later on. So that's for those of you at home. So the risk factors again, did you find then, and we just touched on them there about smoking and about obesity, Barry, did you find you had to change your diet? Is it something that's helped you to, you know, is there any particular lifestyle changes that you've decided upon, and have they made a difference in how you're managing the condition?
Yes, I'm a former smoker, and I saw a huge improvement when I quit, but there was a delay of about 12 months before I saw this improvement. It's not something, there's nothing straightforward about this condition. I'd almost expected it to improve overnight after quitting smoking, but that didn't happen. It took a long time, but I've seen a huge improvement since then.
Really?
Another big thing for me was stress. I was in a very stressful job at the time, and I started keeping a diary and found a link between stress and the severity of the flare-ups I was having. So I got out of the line of work I was in and got into another area, and I've seen a huge improvement since.
Okay, so those things have actually made a big difference.
Yeah.
We talked about stress there, and can the likes of stress and anxiety bring on inflammation and a flare-up? Would you see that commonly, Catherine?
Yeah, well, I suppose I can see stress like affecting people physically in loads of different ways in general practice, whether if it's just generalized bodily pains, abdominal symptoms, flare of IBS, and I think as Barry has so well articulated there, that it can flare up the HS.
It won't have given you the HS in the first place. Stress definitely drives flares.
I agree 100%.
It definitely. It drives pretty much any skin condition, stress. There's a very strong brain-skin axis. And, you know, it's to do with releasing hormone like cortisol. So there's good science even behind that.
So taking, and it seems like a drastic step, you know, saying I'm stressed, I'm going to leave my job, but actually really focusing on how you can make yourself as less stressful as possible is going to help you no end. You're nodding away with that.
I think it's as important as managing the physical aspects of the disease. You have to spend time building resilience and taking yourself out of situations that you know are bad for you, for your mental health. Absolutely.
Okay, just a couple of questions on this. The link between HS and cancer.
There isn't any.
There's no link at all. Okay, so the idea that may be out there, or fear that people may have, is completely unfounded.
No.
Okay. And another question here: the biggest risks and what are the main signs that we have to look out for when it comes to, I suppose, HS and management of it? What can we focus on? You mentioned smoking, you mentioned obesity. Are there other lifestyle choices that people make to minimise their risk?
Well, I suppose one of the things is avoiding friction in the area, and it's a simple thing, but you know, even if you're having a bad flare, padding the area, it's a very, very simple thing. I suppose what we worry about is where patients are getting no remission, you know, where they constantly have these draining sinuses, you know, and you just can't get control. I mean, that's really nightmare.
Where it's very difficult for someone. Another question here. Are there tests for determining if we can pass HS onto our children?
No, there's no genetic test. No, there really isn't. One thing I would say is if you have a family member with HS, don't smoke, because you'd be adding, you know, two kind of risk factors together. Well, you shouldn't smoke anyway. There's loads of reasons for not smoking, but forget your lungs, think about your skin.
Okay. So I suppose the management and the treatment is one thing, but there is a greater, I hope, the whole lifestyle area to look at as well. Once you sort of diagnosed, identified, and you're on a pathway towards management of the condition, then something like, as Barry said, you quit smoking. You probably feel better all round for that, do you now?
Oh, definitely, yeah. But it is important to point out that there are a lot of people who have HS who've never smoked.
Yes, very much so.
As I said earlier, there's not much that's straightforward about this condition, and that's one of the things. We've many members of the support group that have never smoked and yet have the condition.
Sure. So not to be linking these things too much to the condition, the focus really is on sort of maintaining positivity and managing it and treatments around it. But good to know, though, that there are little changes that you might be able to make in your life that will also help in that regard. So on to management, and we've mentioned that management of this is physical and also hugely psychological. Suzanne, I want to ask you about this because it's incredible what you've done. You're really helping others through what you've gone through yourself.
Trying to. Early days.
Okay, so tell us how you're doing that.
So I've always struggled with dressings, and it was just the worst, because you wake up in the morning and you don't know what way you're going to be or how you're going to dress your armpits in particular. So I just had a meltdown about 5 years ago with a dressing fell out onto the floor. I was at a party and I said, that's it. There has to be a better way to do this. And I'd always had a bit of an idea anyway, so I just approached a product design company and started working on making my idea into a reality. So it's very much, I'm just working as part of a program in National University, NUI Galway, called BioXL, and we are just working to develop that into a real life product.
Right, that's great. That's brilliant. So you're using it's a very innovative way of dealing with it.
Yeah.
Because on a very practical level, talking about dressing wounds and that kind of thing, they're real stress points, aren't they?
But also that, you know, that there's something that's pleasant to wear and that isn't, you know, that looks more like leisure wear than actual dressings. You know, teenagers, people in their 20s, 30s, you know, they don't, you know, image is really affected as well, even from the practical point of view of keeping dressings in place.
Yeah. So that, from, I suppose, physical and psychological point of view, that's very helpful. Barry, what you've done is you're working now in a Facebook group that people will be familiar with. And we talked about that, I suppose, peer-to-peer engagement and just chatting to other people who have HS and knowing you're not there on your own. What difference do you find? What's the feedback been like from having that group? And you've hundreds of members now who are all engaging every day and
unfortunately our numbers are growing all the time. I've invested an awful lot of time and energy into the group because I think there's potentially a fantastic resource there. Dr. Tobin, Dr. Wilkinson can only do so much, but we are the experts on this. we have years of experience of living with it, and when a new member joins the group, they can come in and they can pose a question to the group, and chances are someone else will have dealt with that. They can tell them what worked for them, what didn't work for them, and so on. Another aspect of the group that's very beneficial is the psychological benefit. One of the overriding emotions for me was a sense of loneliness. And I remember recovering from one surgery in a hospital down the country, and I was in a room with a father and son who had had the same procedure as me, and it was the first time I'd ever met anyone that has the condition, and it's a comment that comes up time and time again within the group. People think they were alone, and just to actually be able to talk to other people who have the condition is a great source of solace for many people.
As we mentioned there, there's different severities of HS, but has it been helpful, regardless, that people can connect with each other, even if they're not going through exactly the same thing as somebody else, say?
Yeah, but for each person, whether it be mild, moderate or severe, it potentially has a huge impact on their life, and just being able to connect with others who are in similar situations, who have been through this, I think is very beneficial.
Really helpful. GP, first port of call. What sort of advice do you offer someone? As you say, sometimes it comes at the tail end of a conversation, just as they're about to walk out the door. Oh, I have this thing.
Yeah.
And it can lead on to a bigger conversation. How do you start leading them on the pathway towards, I suppose, if you could explain from going to your GP to then meeting your consultant and the pathway of care there?
So I suppose the management of HS is, it involves a holistic approach. And it involves, sometimes, it can be managed just in primary care, but a lot of the time it involves integrated care between the hospitals and general practice. So we already spoke about how the GP can help with, mental distress, but there are plenty of other ways in which GP general practice is equipped to help the person with HS. So, for example, we were talking about smoking cessation advice. We can prescribe the nicotine replacement products that can increase, that have success rates of 20 to 30%. And certainly it has been shown that a person who does get or does use nicotine replacement products will have a better success rate over somebody that decides to do it on their own. But listen, it's all very much individual. Whatever suits you, we can help work with. Also, there are, we can signpost patients in the direction of smoking cessation officers that are located in most HSE health centres. So if you were to go on the quit.ie website, you'll get your telephone number that will help you locate the person nearest to you that can help support you for smoking cessation. When it comes to weight loss, listen, easier said than done. It's a really hard thing to do. And we now know that it's a lot more complex than, eat less, exercise more, and you'll lose weight. We know that it's a lot more complex than that. It involves the immune system. Like, for example, you could be above a certain BMI and eating the same amount and exercising the same amount as somebody with a lower BMI than you. They won't put on weight, but you will. So it does place extra challenges on you. But I think the positive thing here is that even small reductions in weight can make big benefits for your cholesterol, your blood pressure, blood sugar, and especially when we know that, I suppose, HS as a chronic inflammatory condition like psoriasis, it is a risk factor for heart disease. So as GPs, we want to help protect you from that in as much as we can. So, it is important to go to your GP for your yearly, for your fasting cholesterol, your fasting blood sugar, get your blood pressure checked. And just going back to assistance with weight reduction, your GP can refer you to your local HSE dietitian. There will be a bit of a waiting time, but they can initiate the referral. I know that in the area, in the locality where I work, there's the HSE dietitians run weight loss programs that you can actually self-refer to. And details on that are on HSE website. So maybe your GP would be able to signpost you in the direction of those weight loss programs.
There's lots really at community level when we're talking about addressing some of those risk factors. One of the questions that's come in here, what can be done to improve knowledge among healthcare professionals? Want to answer that?
Yeah, well, so certainly I think there's a lot of work going on around primary care, and primary care really is sort of the first port of call for most, for people entering the healthcare system. And what you're always concerned about is that there's teenagers out there who are wondering, I have this, I have no idea what it is, but I'm not going to say anything about it. So then pharmacists, there needs to be a certain body of work about pharmacists. Within hospitals, and Barry and Suzanne could maybe speak to this more than I, but I think HS patients, they're presenting to ED departments or they're presenting to gynecology departments, and there may be people not putting together the correct, or even to surgeons who aren't putting together, well, actually, this person has had repeated surgeries or repeated cycles of surgery. So certainly within our own hospital, we're doing a piece of work with education on our frontline physicians, our gynecology colleagues and our surgical colleagues. And with the result now that a certain percentage of the referrals to our HS clinic in Tala actually, majority come from primary care, but a certain amount of it comes now from within the hospital.
Okay. That there's a greater understanding. Would you, because that would have been one of the big challenges, would you say, Suzanne, when you were getting treatment and you were explaining what you had for something else, that not every healthcare professional would be okay with it? Yeah,
I think that's fair to say. I think it's definitely changing. A lot more GPs a lot more GPs that I meet now, go to now, would be familiar with it. So I think that's definitely changing. It's definitely been a challenge, but it's heading there.
Yeah.
One of the things I would say, Claire, and going back to Barry's point about peer-to-peer support, you just could not overestimate how valuable that is and how valuable the Facebook page is, because an awful lot of patients now are actually going to their GPs and saying, I have this condition.
Yeah.
They know.
Yeah.
Yeah. They've identified it.
Yeah, because of the groups.
Which is
what you'd hope
an unbelievable service, really.
There could be a teenager out there who'll go online, find the group and say, gosh, this is what I have.
Yeah. And there's such reassurance in that, I imagine, as well. There was another submitted question. Anne-Marie, maybe you take it. How do we go about getting HS on the long-term illness list? The associated costs of living with HS can be very high.
No, and they're absolutely right. And one of the, I suppose, most expensive areas is the whole area of dressings. So what the long-term illness is, it's for patients who there's 3 conditions are covered by it: diabetes, epilepsy, and the last one to go on the long-term illness was actually patients who had been diagnosed with hepatitis C. And it's an old scheme that was set up by the HSE, and it's whereby all costs, if you have those conditions, are reimbursed. And to be quite honest with you, it's an anachronism within the funding system. The HSE don't like it. They would love to do away with it and find some other funding model. So in terms of trying to get it on the long-term illness, I mean, loads of other conditions have tried that. And I honestly, I've been engaged with the department who run this, who are the primary care reimbursement section. I mean, they've taken a lot of things off medical cards and that. I don't mean to rain on people's parade, but I would not be hopeful. But having said that, there are ways of getting dressings, because dressings in particular are very reimbursed, of getting dressings reimbursed. And one of the best ways of getting it, I certainly know from my own patients locally, is being engaged with public health nurses, your local public health nurses, because they often have access to the dressings. And the problem with dressings is loads of them aren't covered by the medical card, or they're not covered by the drug reimbursement scheme. So really the dressings is the I think is the key. Cost, but I'm only saying that from a clinician point of view.
And doctor's visits.
Yeah. Oh, yes. Yeah.
Yeah.
And I think you mentioned that as well, Barry. It is very costly, and it's costs that you have to grapple with all your life, you know.
Put this in context and to put a figure on it, some people have been doing their tax returns at this time of year, and a few members have put in figures in excess of €3,000 between hospitals or between doctor visits and medication, even though we all benefit from the drug payment scheme. But that just puts it in context. €3,000.
I'd say some people could have higher bills, and when they come to the HS clinic, that's free, like within the hospital. But I'd say people could have higher.
Yeah. And of course, the time that you have to take off work when you are really unwell. Some people have to take weeks off to recover from surgery. So there's a lot of hidden costs associated with the disease. And maybe you might want to treat yourself to, I don't know, something that will make you feel good about yourself. And that is, for your for your well-being. And that is a cost, but it's associated with your HS.
Something else you have to factor in.
Yeah.
Just a quick question, and we're going to go to some of the questions we've received online, but just about reducing the symptoms and severities, the impact of lifestyle changes. And I know we've talked about smoking, diet and exercise, but have you seen a marked reduction in patients that you've been working with when they have taken on board lifestyle changes, Catherine?
Yeah, I think it does make a difference. Like what Barry said, smoking cessation does make a difference. And we do know that like weight loss, it does reduce severity of the condition. So,
and does it help everyone?
No, I would have to say it probably doesn't help everyone. And Barry makes a really valid point. So there's 2 points to make about HS. None of the treatments are perfect. We're far off having perfect or very, very effective treatments for HS. And there certainly is a lag period between giving up smoking and losing weight. But the vast majority of people do benefit. But Barry makes a very valid point that it doesn't happen overnight.
Okay, and just to come back, another question just on some of the physical challenges that you're facing every day with HS. I think you've touched on obviously what you're bringing along to help with this in terms of the dressing, but the pain around it and the frequent dressing changes involved. But are there also challenges in performing regular daily activities? Would you have found that, Suzanne?
Yeah, sometimes even walking is difficult sometimes. Or I used to be a baker, so I used to use my arms all the time, and if I was bad, it would be a tough day in work. Absolutely. Yeah, it's profound.
Yeah, I suppose the friction and any physical activity requires
even
friction.
Moving, even standing up would be sore sometimes.
Have you experienced with that, Barry?
Well, I remember the period I referred to earlier on in my earlier life when I had it in both armpits, and raising my arms above my shoulder height was nigh on impossible. That made simple little things like putting on my clothes in the morning, having a shower. Things like that were exceptionally difficult and took several times longer than what they actually normally do. Yeah, there are some physical challenges, but as Suzanne said, over time you become resilient and you learn to adapt.
We did conduct an online poll, and the question was, would you be willing to share with us which of the following aspects of your life is most affected by HS? So the results have come in, and performing daily activities at home, you mentioned even having a simple shower, that's really what affects most people, 36%. Mental health, 30% of people said that is what is most affected when they have HS. Sleep at 20%. So that, and we can go into that briefly, an impact on work productivity, 10%, and personal relationships, 10%. The sleep one is quite interesting. Is that around the medication you're on, making it more difficult?
No.
The pain of actually trying to get to sleep?
pain and discomfort.
Pain.
Pain and discomfort.
I remember going through periods where I lost a lot of sleep because you'd wake yourself up at night by moving into a new position that would send a jolt of pain through you. You'd eventually fall back to sleep, and the same thing would happen repeatedly. You'd wake up in the morning exhausted, and
Drained.
Oh, absolutely drained, yeah.
And dealing with spasms of pain all night.
Oh yeah.
What's that?
Get really itchy sometimes at night time.
Yeah. And are there over-the-counter things that can help you with that as well, or is it always requiring, I suppose, something that's stronger and more medicated?
Certainly, some patients, I'd always make sure they had a supply of pain relief between their visits to the clinic.
Okay. This is a question I think that we've already dealt with, but it's just on the length of diagnosis, and it seems to be something that people obviously are voicing a little bit of frustration with, but the main consequences of a diagnosis taking so long, is the fear there that people will sort of self-medicate or not receive the correct path to managing the illness that they need?
Well, I think if they're not diagnosed, they can't receive the correct path. And there are good papers showing that, you know, you can pass through 7 different doctors, 5 years, you know, there's all those statistics before you get a diagnosis. The hope is that we're changing that we're actually contracting the time right down. And I think patients are active partners in that. I think they're working as hard as we are to try and contract the time down to diagnosis.
If there was one thing, Suzanne, that would make your life easier, what would it be?
Probably not to have surgeries. I've had probably one surgery every year since I was 22. So I'd love to not have to do that.
I presume the recovery from such surgeries also takes a huge amount of energy.
Yeah, some of them are big surgeries where you'd be off for about 8 weeks, and some of them are very minor. So that's probably a bit traumatic, surgery every year. Some of them are just in and out, and you'll be back in a few days. But some of them have been quite significant, and it's 8-week recovery, I'd say, from the worst ones.
That's a lot of time. Yeah, that's a lot of time if you're trying to hold down a job, family life, and everything that goes with it. Barry, anything that would make your life easier if something were to change tomorrow?
Coping skills, I think. The capacity to deal with the emotional effects, the mental effects. The doctors help with the physical effects, but just the capacity to be able to deal with the adversities that you encounter day to day in living with a condition like this.
And if you found a good point or a good area, like people talk mindfulness, I know it's all the rage, but is that something that you've kind of looked into or has helped you? Are there little practical exercises that have helped you through the day?
Well, I find a good work-life balance helps enormously, and I put a lot of time into physical exercise because the links between physical exercise and mental health are well established at this stage. And as the World Health Organization state, there is no health without mental health. So if you look after your mind, the rest will follow, hopefully.
Okay, that's very good advice. Any last words from you, Catherine, on how you think people can best get help and help themselves through HS?
Well, I think like what Barry was saying regarding mental health, like routine, healthy eating, trying to get enough sleep at night, because if you're not sleeping, I know pain is obviously a challenge to overcome, but if you're not getting enough sleep at night, it's going to affect your mental health the next day. And I suppose, you know, if you are distressed, just make the appointment with your GP and make that the focus of your consultation.
Okay, that's very sound advice. Well, I think that just about leaves it now for tonight. And I just want to thank everyone who's joined us here in this room and for everyone who's dialed in online and joined in the conversation. And I think there's been some really great questions there that have been submitted to us and great questions that have come in online that I think have helped really inform this chat. So I hope that everyone this evening has got something out of it. What struck me, I suppose, is above all else is the power of how we can support each other. From something as simple as a Facebook group and how that can really help you get through your days. You've got the senior medical advice and we have all of that there, but just at a very basic community and peer-to-peer level that something like a Facebook group can be so helpful. Yeah. And then also the experience of someone who is going through how you are an expert in your own field and you've used that, Suzanne, to try and help others now has been really inspiring. So just want to thank everyone for coming this evening, and that just about leaves it. And again, we did have all our questions submitted, but there may be some questions that you'd have for our panelists, and they're happy to talk to you when we finish up here tonight. They're happy to stick around. So thank you all very much. Oh, before I go, I also want to mention the helpline that's available through the Irish Skin Foundation. If you go online to the Skin Foundation website, you'll get details of that there. And if ever you need a helping hand and a voice at the other end of the line, they're there to help you. Okay, thanks everybody.